impact on your quality of life. Here's more.
Patients come to me for a variety of reasons. It could be that they have a spouse who says that they can't hear them, or they have themselves noticed changes in their hearing, or they have ringing in their ears. As an audiologist, I do the diagnostic testing for anywhere from the infant who was born with a hearing loss up until our centurions who have problems with hearing or balance or communication. For patients who have a hearing deficit, often the first signs are somebody is telling them that they have a hearing deficit, meaning they're saying what a lot, or they're asking people to repeat, or they're withdrawing from the conversation. They're not engaging like they used to. They find situations such as restaurants that might be a little bit noisier to be environments that they don't communicate well in. It's become difficult for them to really engage in the conversation and to really interact with their family, their friends, their business associates. It starts that downward spiral to the quality of their life, and it begins that spiral of them withdrawing from situations that they find difficult, and that withdrawal then continues as they become more and more impaired. So you might take someone who was very, very active at one particular time that now finds just sitting in their house watching TV is about all that they really want to do. Individuals with hearing loss, especially hearing loss progresses over time, do not realize that they are withdrawing and that can change their physical and psychological demeanor, meaning that hearing loss is closely tied with depression. It's closely tied to the increase or the progression of Alzheimer's and dementia, and we're finding that it creates issues other than just not being able to communicate. For most people, because hearing loss is gradual over a period of time, they've compensated. They've just turned the TV up a little bit louder. They just resigned themselves at certain restaurants they shouldn't go to. Church services, while at one time was very prominent in their lives, it's just more difficult to get to, and once they're there, they don't understand what's being said. So they tend to just withdraw a little bit, and little bit, and little bit, to the point where they are at a situation in which they're basically have chosen to be homebound. When we do get patients that come in here and we are able to fit them with hearing aid devices or instruments, it is really an eye-opening enlightenment for them, because they don't really realize how much they can't hear. Hearing aid technology has continued to develop, but in the past 5 years has really gone from the basic standard instrument to a more digitally enhanced technology that allows the audiologist to really prescription fit a hearing loss. If this is someone who is very active, attends a lot of meetings, loves to be on the golf course, is very active in volunteer work, then the technology allows us to program that hearing aid for all those different types of listening environments. If this individual is someone who needs something for church that's very important, or synagogue, or bridge on Wednesdays, or shopping at the grocery store, or seeing their hairdresser, or visiting their doctor, then we can also program that hearing aid for those listening environments. As we age and as we decide as a society that we want to live in our homes longer, then it's very important that we are able to engage with those people that we need to communicate with in order to stay in our homes. Our caregivers, whether that be someone that comes into the home, whether that's our doctor, whether that's our pharmacist who's helping us with our medications. So it's really important. Communication is really important for all of us, and it's especially important as we age, that we maintain the highest level of communication skills that we can.
We're off to a quick break, so stay with us.